everybody. This is Jennifer Garcia. For those of you who don't know me, I am the co-founder of Vet Companion and also a veterinary internist. And I apologize for the casual attire. We are hurricane prepping here in Houston today, and hopefully nothing is going to happen, but we like to be prepared. But I did want to touch base with you because some of our Vet Companion users have asked for some guidance or some tips on using Sdma in clinical practice, and so I thought I'd just make a quick video for you guys today heading into the weekend. So Sdma, it's a test that's been around for probably a couple of years now. I think it's primarily, only run through IDEXX. My understanding is they're going to be coming out with an in-house version of that test probably by the end of 2017. So it's a test that I think a lot of people have at least heard of and are using, but you certainly run into situations where you kind of wonder what are you supposed to do with this information with this particular patient. And so Sdma, as you know, is a surrogate marker for GFR. And so I think it provides us just another parameter to monitor. I don't think it's, the end all be all. I don't think we should hang all of our diagnosis on an Sdma, but certainly I think it does help provide more information, and the more information that we have for our patients, the better we can tailor their treatment and, their interventions. And so usually for me, the way that I use Sdma in clinical practice is I think it's a good baseline parameter to have for all patients, for dogs and cats, because I do think that it allows you then it gives you another parameter that you can monitor and look for trends. And so if you're noticing that your patient is having trending with an elevation in their Sdma, but their BUN and creatinine are stable, then that might be a patient that you need to pay more attention to. We know that with kidney, you need to have at least 65% loss of your kidney function before you're going to see an elevation in the BUN and creatinine. But with Sdma, the research has shown that we can have an elevation in the Sdma with as little as 25% loss of kidney function. The average is about 40%, but with as little as 25% decrease in kidney function, you can start to see an elevation in the Sdma. So it's reasonable to expect that the Sdma might start to elevate before you're going to see the elevations in the BUN and creatinine. And I think that's really, for me, where I feel that test is most useful, because then I know that I need to pay more attention to that patient. So if this is a patient that you're seeing during their annual exam and you notice these changes, then you know that this is not a patient that you're going to want to wait until next year to see again. So this is a patient that you're going to want to see next month even to see whether or not they are changing in terms of their values, their renal values or their Sdma. The other thing that I think is helpful is that that's a patient then too that you're going to probably do a little more looking, a little more investigating. So even though they don't have overt azotemia, if they're having a trend in elevation in their Sdma, then those are patients that you're going to want to make sure you've measured their blood pressure. Are they hypertensive? Is there something there that would indicate you need to intervene on that? Do they have proteinuria? So checking their urine, doing a urine protein creatinine ratio, I think is a good idea in those cases as well. If there's any reason to suspect that they have infection, you're going to want to culture those patients, because you want to be as proactive about it as possible. We don't really have any research to suggest that putting these patients on a renal diet is going to prolong survival or going to slow the course of their disease. And so, some people are kind of on the fence about whether or not it's time to go ahead and put them on a renal diet. I don't necessarily think it's a bad thing to do, but whether or not it's indicated, it's controversial, and we don't really know. We don't have that information. So I think that's where Sdma is most useful, is monitoring trends and knowing, which patients you need to be more proactive with and you need to see more frequently and do more monitoring, and any other ancillary testing like imaging, getting x-rays, getting an ultrasound, seeing where things are at in terms of their kidney function. Those are also patients that you're going to be even more careful with using any drugs that may affect the kidneys. So NSAIDs, for sure. Those are patients that you're going to want to be super careful with anesthesia and making sure that they're monitored well and they're hydrated and their blood pressures are monitored and that we don't have any hypotensive episodes while they're anesthetized, because we know that those patients have questionable kidney function. Even though they're not overtly azotemic, those are definitely patients that you want to pay more attention to when you're using drugs or anesthetics or things like that that can affect the kidneys. So I think The other thing that I use Sdma for that I think it's helpful for is in patients that you already know have chronic kidney disease and you've already staged them, so they already have iris staging. Their disease is stable, but the Sdma again allows another thing that you can monitor for progression and also knowing whether the interventions that you are doing are making a difference. So if the patient is on hypertensive medication or is on a renal diet or they're getting sub-Q fluids or things of that nature, I think it allows you to have just again another piece of the puzzle, another parameter that you can monitor to see whether or not what you're doing is helping or are they getting worse in light of that. And it helps just sort of generally know where we're at with their disease. So I think that's the basic stuff that I use Sdma for. I think that's where that test is most helpful. Again, I don't think it's the end all be all, but I do think it is a good parameter to monitor because I do think it gives us the more information that we have, the more we can help our patients and intervene for them in a more timely manner. So if you have any other questions about it, I would love to hear from you. So please leave me any questions in the comment section and I will talk to you again soon. I hope you guys have a good weekend. Bye.